healthcare sector, whose mission is to protect and promote health, consumes large amounts of energy. This high energy demand contributes significantly to emissions, especially when sourced from fossil fuels. Decarbonizing health facilities and transitioning to clean renewable energy will help the healthcare sector reduce its climate footprint. Investing in energy-efficient systems and clean power in healthcare is not just a climate solution, it is a public health imperative.
From the hospital point of view, we were thinking of how we would contribute towards sustainability. As you are increasing your services, your time of work and stuff like that, your electricity bills go on increasing. There are certain tariffs that get incorporated into your running charges every time, which escalates your bill. You have power cuts in summer, you'll end up using a diesel generator for those times, so your fuel costs go up. And that was when the decision was taken that we have to use clean energy. And I think solar is one of the better options or good options that we have at this point of time, which is why we went down that route.
As a proof of concept, what we did initially is in the year 2016-17, we have picked up few campuses where an initial 150 kilowatt solar rooftop systems were planned in 5 different campuses. So by 2017 January, we have completed 90 kilowatts in 3 campuses and we started testing its outcome.
For eye care institutes, transitioning to solar power is practical and cost-effective. Since most procedures are performed during daylight hours, and inpatient care is minimal, energy demand aligns well with solar generation, reducing or eliminating the need for battery storage systems.
Within a span of 3 to 4 years, the entire cost that is invested initially has been recovered. That means the next 20 plus years, whatever money we are able to accrue in terms of the saving, it is going to help that particular center's patient care services directly and indirectly.
The LV Prasad Eye Institute's tiered healthcare model demonstrates how decentralized care can advance both environmental and social goals. By bringing primary, secondary and tertiary centers closer to rural communities, it reduces travel-related emissions and saves time and wages for low-income families, promoting both climate and health equity.
The Scope 3 emissions contribute in terms of the transport related emissions. So by bringing the healthcare into their doorstep, we are able to cut down that Scope 3 emissions by bringing down the transport requirements.
LV Prasad Eye Institute successfully attracted climate finance from private donors by presenting a strong evidence-based case.
If any donor is going to support, let's say 100 cataract surgeries with an X amount, the same amount if we are able to invest into putting up a solar rooftop system, after 4 years of the cost that is recovered for investing into a solar rooftop system, the remaining 20 years, the energy cost saved, it can support more than many more hundreds of people to whom we are able to provide the same cataract services without any cost to the patient. So we got one donor who are in the space of microfinancing. Through their CSR initiative, they were kind enough to support for one of the projects initially in Hyderabad.
LVPEI has embarked on a transition towards energy efficiency by replacing legacy equipment with energy-efficient alternatives.
So what we started doing is, in all our upcoming projects, we have mandated it that all our procurement will be as much as possible to choose energy efficient options. maybe it is air conditioners, maybe it is a ceiling fans, which are today we are going with all the BLDC fan, or even the light fixtures. Today we can able to get higher luminosity with a lesser wattage LED options than compared to the CFLs and the T5, the conventional tube lights what we call. So these are all different measures which we continue to do in all our campuses. We look forward to many people to support all our such initiatives, and this kind of climate financing funds that is available and operated by national and international organizations, I would call that could be a good opportunity in the coming times to look forward and make a kind of a case that would help both the stakeholders, one to receive these kind of funds to further scale up of our activity, and the other organizations who fund the money to spend at the right place for a bigger cause.
Every country's health sector should advocate for phasing out fossil fuels and transitioning to clean energy to achieve zero-emission healthcare and protect the public health from the effects of climate change.
Global level, we are showing that we are actually out there with everybody else, trying to make efforts as far as eye care organizations is concerned to contribute towards, bringing about that sustainability movement, which we hope that others in the country will also follow.
By powering care with clean energy, we light the way towards a healthier, more resilient future for all.